Hey, hello everybody, this is Dr. Bob and I want to welcome you to another episode of Ask Dr. Bob. And I want to talk to you today. We're going to totally change the normal routine for Ask Dr. Bob, and I'm going to give you 10 points to prevent a heart attack. You know, regardless of who you are, you could have a heart attack at any time in your life. I recently was at a seminar, and the gentleman who was a part of the lead musician for the group, 3 days later after the seminar, he passed away. When I was at the seminar, I mentioned to my wife how he looked, and he was inflamed. So I'm going to give you 10 markers that you want to take heed. Please pass this on. Number one, you want to maintain normal blood pressure. In our practice, we use magnesium orotate. Magnesium orotate. I'm finding an epidemic of people over 50 years old are having heart palpitations, anxiety, high blood pressure, leg cramps at night because of lack of magnesium. We use magnesium orotate anywhere from 1 to 3 a day. You can take as much as you need until you get loose stools. That means you might have more rapid bowel movements. You should take it right before you go to bed at night. Men, you should not have a waistline greater than 40 inches. Ladies, not greater than 35 inches. And the reason is that extra abdominal fat is going to create stress on your liver. Your liver has blood flowing through it on the way to your heart. Waistlines are very, very important. Sugar depletes, this is number 3, B vitamins and minerals. B vitamins are needed for the heart muscle to contract properly, and the same with minerals. Celtic sea salt, a whole food B vitamin, is really important. Here's something else that's significant. You want to be taking omega-3 oils on a regular basis. This is number 4, to reduce inflammation. We use an anchovy, sardine-based oil. It's less toxic. We don't really promote tuna oil, salmon oil, and some of the other oils because of toxins found in those fishes. Next, number 5, annual blood testing for something called CRP, C-reactive protein. It's inflammation. You could also have your homocysteine levels checked. Tend to get high, greater chance to have potential heart challenges. We also do something very special in our practice called EFA, essential fatty acid blood spot testing. We're looking for your EPA, that's eicosapentaenoic acid. I know it's a big word, but if your EPA is low and your trans fat is high, you have inflammation going on in your body. And these tests, probably less than $500 a year, even if you do it every 2 years. We're trying to help prevent death. The first symptom in 250,000 people that have a heart attack is death. It's no small deal. Reduce dairy products like ice cream and yogurt. There's a process called glycation. Glycation is inflammation. There's a plastic surgeon in our community that will not do surgery on someone's face that eats yogurt because the sugar and the yogurt, the two come together, the sugar and the protein cause glycation, which is inflammation of blood vessels. Number 7, exercise aerobically every day. When I say aerobically, I'm talking about riding a bike or jogging, but the key is to sprint really fast or ride your bike really fast and slow down. That puts a demand on your heart. And if you're over 40 years old, it's going to start what we call anastomosis, which is the development of blood vessels. See, if you're 50 or less and you have a heart attack, you'll probably die because you don't have anastomosis, which are the little blood vessels that migrate to other heart muscle in your body. That's why you want to do this accelerated aerobic exercise periodically. Vitamin D. Your vitamin D should be at least 30 or above. Vitamin D helps the absorption of calcium in your body. Calcium relaxes smooth muscle. Vitamin D will also help lower your blood pressure. Limit all alcohol and caffeine. I know they tell you to drink wine because of the resveratrol. I'm going to tell you right now, alcohol and caffeine will raise your blood pressure. So if you're having a party and you're drinking a lot of alcohol and drinking a lot of coffee, you could literally pass away of a heart attack because your blood pressure is going to be maxed. Drink a minimum of 1 quart of water every day. Number 10, avoid the inflammation caused by trans fat or partially hydrogenated oils, which includes margarine. Trans fat causes inflammation and actually cause heart disease. 2 bonus comments. Aspirin use and normal cholesterol levels do not guarantee that you won't have a heart attack. These were some very important tips. Please pass these on. It's a matter of life or death.